Hi, I'm Eamon Costello, CEO of patientMpower, and I wanted to share some very exciting news about a new NHS funding award that we've won. The funding is an SBRI Healthcare Phase 3 award, and it's designed for real-world testing and implementation of solutions in respiratory disease to provide access to the right care at the right time. The award is specifically designed to support later stage innovations to gain the evidence and real-world validation needed for NHS commissioners and regulators to make purchasing recommendations with the aim to benefit patients. We will use the award to increase the depth of understanding of the outcomes of using our technology to change the way respiratory care is delivered. Using the gold standard in study design, this will be a randomised control trial comparing usual hospital-based care of patients after lung transplantation with an alternative hybrid approach of care using the patientMpower platform. The goal is to reduce patient burden while increasing clinician capacity. Used in conjunction with ongoing home monitoring for rapid identification of potential complications, it is envisaged the trial will deliver robust evidence of the benefits of this right time, right place approach to patient care. The study will not only collect health outcome data, but will also report on the health economic impact of care transformation. This is vital in the wider adoption of technology to support patient-centric models of respiratory care and will have implications not just in lung transplantation, but also for other chronic lung conditions like interstitial lung disease, cystic fibrosis, severe asthma, and severe COPD. We'd like to thank NHS England and SBRI Healthcare and to our partners, John Blakely at Manchester University Hospital and Elena Pizzo of University College London, and to the patients and caregivers represented by the New Start charity in Manchester. You can find out more information on the study by going to our website patientmpower.com, and we look forward to keeping you updated on the study's progress. Thank you.